If you remember the first study, 0.2, 0.5, 1 millimeter, is the same thing. 1 millimeter is too much. And for the body to do a healing, natural healing. So, if you take some autogenous bone, you put it on a site to regenerate, all the autogenous bone cells that are far from 1 millimeter from a vascular source, they will start the process of to die. And what it will serve? It will serve that the blood that is all around those autogenous bone will, with their own stem cells, go to be new bone. So this autogenous bone will have the behavior of a biomaterial, just to be a scaffold for a new clot, blood clot. That's it. So, is it so necessary to go to a second step, to a second site of surgery to take a sample of autogenous bone just to have biomaterial? Okay, it's not expensive, I agree, but it's not so necessary.
It's same.
It's
same.
That biomaterial. It's a biomaterial, and small, some parts of the autogenous bone will survive. I agree with that. Some part, but the most of the biomaterial will resorb and will just work as a biomaterial and not as a living autogenous bone. Understand?
Yeah.
This is a study with Chapard and Guillaume, and what we did, I worked with them. We took some autogenous bone, and you know, between the harvesting and the time when you put the bone in the reception site, it takes 20 minutes usually. You have to grind it, you have to make a hole, and they wanted to know during the 20 minutes that the new bone is out of blood, how it will become. And what they see, so this is an osteocyte inside the lacunae, okay? So it's living bone. This is the destruction of this osteocyte, and this is an osteocyte empty, so dead bone, okay? That we can look. And what they found here, they found that 30% of the autogenous bone from the harvesting is dead after 20 minutes. 20 minutes, 30% dead of cells. That is the result, and it's a specialist of histology from the INSERM in France, very well known. It's serious study. Okay, so after that, so if you like autogenous bone, no problem for me. Okay, I don't give advice for one more to another. You can work, but think that you work with a biomaterial more than you work with some living bone. Work with it as a biomaterial. That's it. It's very important. After that, à quelle heure on a commencé? Ok. Vous me dites quand est-ce qu'on fait une pause, Riyad? Tu me dis à quelle heure? At what time you want to do a break?
No problem.
It's okay?
Yes.
Okay, I go. Okay, so, because I see some of you sleeping, so I'm afraid. It's the digestion.
I'm changing my
Okay.
but you are changing my concept about the autogenous bone now.
Okay,
You
no
are
problem.
taking
I
me
just
to
give you some
biomaterial.
advice, some information, and you have to do your own practice.
You are pushing me to biomaterial. You changed my concept before 3 years ago and changed now.
Okay, it's my pleasure. Okay, so now we will try to work with mineralized allogenic bone, biomaterial.
Sorry, doctor. The autogenous bone, if we make it like powder, same or?
Excuse me, what is the question?
If you didn't take block autogenous bone, you take it as a
Grind.
particle, grind it. Yeah.
Yeah.
The same concept.
The same reception?
I think that is better when you work with autogenous bone. I think it's better to grind it as a biomaterial and to use it as bio-os or something like that. I think it's better. And so, but you have to know how to handle this, because it's more easy when you screw a block. It's easy, it doesn't move. But when you use like a guided bone regeneration technique with biomaterial substitutes, you have to know really how to handle for the material not move during the few months, and so you have really how to know how to close, how to maintain the space.
But we don't need to put
But
maintain.
if it will work, it will act as a biomaterial. It's better to use a biomaterial. No need to open another site for surgery or something like that.
I agree with
now
you.
we are going like
I
that.
completely agree with you.
Yeah.
But I let you the choice. I am here not to give you one response as mine. I give you just some information for you to choose, to be able to choose. Sometimes
About
you will find a patient that doesn't want some co-bone or I don't know what. He wants to give me mine. So you have to know how to handle with. That's some-
about membrane.
Qu'est-ce qu'il y a?
هيتكلم دلوقتي انواع البايوماتيريال
لا نستخدمه مع
مع التوجينوس
اه.
لا التوجينوس بول ما استخدمش ممبرين بيستخدم بول بس بتاعه انت بتستخدم بلوك بياخدها من هنا مثبتها
Do you like
بلوك
this
نفسه
cookies or not?
إذا طحن
I love this man. You know?
كلش ممبرين
Okay. So,
Je suis au cours de New York University.
hein? Là, t'as vu, hein, je leur...
It's like a course in New York University, all in English. And I am French, I don't understand English.
Okay, so now, you know how it works. They harvest from people that do a hip surgery, you know. In France, it works like that. People has to give for free his hip, or the part of this bone. And so it's difficult to find a surgeon that wants to give that for free, because they want to be paid. And so it's not easy. That's the reason why it's very expensive at the end. This bone, as a substitute, is very expensive. I don't know, it depends of the laws in different countries, but in France, the people have to get that for free. So when you have harvesting, transportation in special cars, transformation, and sometimes it goes for other patients as a biomaterial. Okay, so we have to take out from the femoral head, on appelle ça femoral head? Ouais? Okay. We have to take out from the femoral head the marrow. That is the main work that we want for this biomaterial, because we want in this biomaterial to let the collagen and the mineral part, just to let out the fat, the marrow, the cells of all those kind of cells. So you have different solutions, chloroform, acetone, or some with jet pressurized water on. So you go from this femoral head to this clean femoral head. You have a lot of studies about the safety of that, because it's a big question from the patient. Here in France, when you put some allogenic biomaterial on a patient, he never can give blood as a donation. No. So because they are afraid of some transmission or I don't know what. In the studies, they say to you that it's not 100% safety. Never. Because there is maybe some pathology that we don't know for the moment, and that we can know 10 years after. So they say, they just say in all those studies that there is 0.00002% of risk. And what we can, for the moment, also know is that we never had this risk as a reality. Never. It's a risk. in a percentage, 0.00002, but we never saw one patient with a problem due to the safety. Understand? So the risk exists, but for the moment, more than 20 years ago, we don't have any problem. But maybe we don't know everything. Okay? I can give you an example. I had to do a surgery to the boss of one of those bank bow. And I knew after by the assistant of this man that he took one full day to choose his own biomaterial for him. You understand? So I say to him, what is the problem? You are sure of that or not? He was crazy because every sample is with blood exams and everything. So he just had to take one and that's it. No, he took one day to select the patient for him. So I'm afraid, I say, well, if he does that, maybe there's something that doesn't work so good. No, it's just a joke like that to tell you. Okay, so after that we have a demineralized allogenic biomaterial. What is this biomaterial? Did you ever see this? Yes? What is a bone that you take and you put it in acid that will eat all the mineral part and just will let you the collagen part. Those are collagen fibers. And one man whose name is Urist in 1965, he did one experience taking some fibers like that, opening on a rat or a rabbit the back, opening just the skin, okay, and he put this biomaterial between the muscles and the skin. So there's no possibility for the bone to send vessels to give osteoblast, osteocytes, and everything to give some new bone. And he saw that 6 weeks after he opened and he found some part of bone in place. So what he spoke about? He spoke about the bone morphogenetic protein. Okay? It's a protein that is inside the collagen fibers and that can help to do bone even if there's no bone around. No osteoconduction, osteoinduction. Okay? That's the Urist experience. What I saw is that in my own experience, it never worked, this biomaterial. Because when you open a site, I did that in the sinus in my first experience. I opened the sinus, I lift the Schneiderian membrane, I put this material, but it's collagen. Did you ever work with a collagen sponges? You have some collagen sponges. You see, you put firstly it's good and when you put with blood, it flows. It's the same thing. It flows. You don't have biomaterial that gives you a volume. It flows so it was impossible for me to be sure that I filled all the sinus. After that, I opened and I didn't find any new bone in the site. So when I worked with the researcher from the INSERM that was used to work with animals, he said to me one thing that I didn't know. On the rat and the rabbit,